It's Renata Jones, and I'm here today to go over the 4 Medicare enrollment periods. So if you are a Medicare beneficiary, or are you about to become a Medicare beneficiary, meaning you're about to be the age of 65, you may find this very helpful. If you're already taking and receiving Medicare benefits, you may also find this helpful to know when you can and cannot change plans that you're in. So I am Renata Jones. I am CEO of Age-Int Incorporated. We are a managed care consulting organization. I am also an insurance agent where I specialize in selling Medicare insurance. And so one of the things that is very true and passionate for me is just educating people about their healthcare benefits, in particular Medicare. So today we're going to go over the 4 times or periods that Medicare beneficiaries can actually enroll into a Medicare plan. I'm going to be referencing a brochure that I put together as RJ the Agent. That's who I go by in my Medicare business. But on the back of it, it actually talks about your Medicare enrollment periods. So there will be a digital copy of this. If you would like to download it, please feel free. So let's start with AEP. So we're going to start with AEP, which stands for Annual Enrollment Period, okay? And it's exactly what it sounds like. It is a period. Oh, and I spelled it wrong. So, annual enrollment period, AEP, is exactly what it sounds like. It is every year when a Medicare beneficiary is able to change plans for the following year. Now, this time frame is the same every year. It is October the 15th to December the 7th. So, it starts in October and it runs through December. So, on the 15th of December, the 15th of October to the 7th of December, every single year, a Medicare beneficiary can decide what plan they want for the next year. Say you are very satisfied with whatever plan you're in, you do not have to change. You'll just roll over into that plan for the following year if that plan is still being offered in your service area. So AEP stands for Annual Enrollment Period. It is exactly what it sounds like. It's an annual period where everyone who is eligible and enrolled, or not enrolled but eligible for Medicare, can pick what plan they want for the following year. And remember, it runs every October 15th through December the 7th. The second one that we're going to talk about is IEP. IEP stands for Initial Enrollment Period, okay? The initial enrollment period is sort of what it sounds like. It's whenever someone is initially eligible to enroll in Medicare. So if you are 65 or getting ready to turn 65, you're becoming eligible for Medicare. Now, there's some other instances where you do qualify for Medicare, like if you're disabled, but we'll go over that in another video. However, if you are age 65 or you're getting ready to turn 65, your IEP, or initial enrollment period, starts 3 months before your 65th birthday. It includes the month of your birthday, and it's 3 months after your birthday, okay? So you have a 7-month. All right, let's see what we got here. So you have a 7-month window, which is called your IEP, or Initial Enrollment Period, for when you're turning 65 and you're now eligible to join a Medicare plan. Okay, so that is the 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So my birthday is in November. And this is going to be a tricky one because, as you're going to see, because my birthday is in November, my AEP and my IEP overlap. Okay, so since my birthday is in November, that's the 11th month. So August, September, and October are the 3 months before my birthday. And so August, September, October, those are the 3 months before. then November, which is my birthday month, and then December, January, and February are the 3 months after my birthday. So technically, my IEP would be from August through December, January, February, through February. Because it's the 3 months before your birthday, the month of, and then 3 months after. So let's say your birthday is in May, which is the 5th month of the year. So you're actually going to start February, March, and April is your 3 months before, and then you'll have May, which is the month of, and then June, July, August. So you'll have February through August is your 7-month window to use your IEP. Your IEP can only be used once. So once you use it, can't use it anymore. It's one and done. You're finished with it. You'll know in another video that another reason why IEP is important, because you have to make certain decisions during your IEP, whether you're going to get a prescription drug plan, maybe you're still working and you don't want to get Part B benefits during that time. Whatever the case may be, there's some decisions you need to make during your IEP so that you do not get hit with a late enrollment penalty later. But that will be in another video. Again, this video is just to go over the 4 different enrollment periods. So now we've got our AEP, we have our IEP, and then the next one that we're going to go over is going to be our OEP. And this stands for Open Enrollment Period. Now, it's not as it sounds, so it's not necessarily open. It is only open for people who have chosen a Medicare Advantage plan during their AEP. And so what happens is CMS, which is the Centers for Medicare and Medicaid Services, the government, Medicare, whatever you want to call them, they said during AEP, maybe you didn't change plans, or maybe you did change plans, and when you got to January, you're like, wait a minute, I thought my doctor was going to be in this network, or I thought this prescription drug was going to be covered, or whatever the case may be. You're like, I really don't like this plan. I really wish I could go back to the plan that I had, or I could go to another plan, or maybe you want to drop it all together and go back to original Medicare, whatever the case may be. CMS says during OEP, which is January 1st to March 31st of every year, anyone with a Medicare Advantage plan can choose to leave that Medicare Advantage plan, go back to original Medicare, or choose into another Medicare Advantage plan. Okay, so this is January 1st through March 31st every year. Okay, so it's a 3-month window from January 1st to March 31st, and remember, it's if you made incorrect choice during AEP, or maybe you didn't make a choice at all and you wish you would have, or you chose the wrong plan, or your physician's not in the network. Something happened as to where you know you're not happy with the plan that you chose or didn't choose during AEP. Then open enrollment period for those who have a Medicare Advantage plan, you have from January 1st to March 31st to move into another one or go back to original Medicare. And then the other one is going to be SEP, and it is Special Enrollment Period. And it is exactly what it sounds like. It's an enrollment period for special circumstances. And so some of these circumstances could be maybe you're leaving the hospital, you just had a hip replaced, and now you've got to go into the nursing home for an extended period of time. Okay, so that's now going to be an ISNP, meaning you're now going into an institutionalized facility. So it would be, the term would be ISNP is the way they call it. Maybe you now qualify for Medicaid, so now you are able to, you're qualified as a dual eligible, meaning you have both Medicare and Medicaid. That is a D-SNP, so now you can move into a D-SNP plan. Maybe you didn't get full Medicaid benefits, but you get extra help, also known as low-income cost sharing. So now you have a special enrollment period where you can actually move from the plan that you're in into another plan. Maybe you moved, you've retired, you used to live up north, now you're going to come down to South Carolina and you're going to move to Hilton Head. Well, your plan that was in New York is no longer offered, of course, in South Carolina. So now you have to pick a plan that's in your service area. So these are all reasons why you may be granted a special enrollment period and you can actually enroll into another Medicare plan. All right, so these are Again, like our I-SNP, meaning you're going into an institution. We have D-SNP, meaning you now have Medicaid and Medicare. Or there's also something called C-SNP, which is a chronic care special needs plan. Um, so C-SNP, you can move into one of those plans. Maybe you have a chronic condition, so maybe now you've been diagnosed with diabetes and you now have a special enrollment period where you can roll into a C-SNP plan that is designed for people that have diabetes or have heart disease, whatever it may be in your area. So those are just, or if you moved, that's another reason you might get a special enrollment period. Maybe your plan's no longer offered, they're leaving the market, whatever the case may be. Those are all opportunities for you to have a special enrollment period. So, just to recap, we have our AEP, which is our annual enrollment period. Remember, that occurs each year from October 15th to December the 7th. That is for people to go ahead and pick their new Medicare Advantage plan for the following year, their prescription drug benefit plan. Maybe they want to go into a Med Sup. Maybe they want to leave out the Med Sup. Whatever the case, this is a very important period during October 15th to December the 7th for everyone that has Medicare to review your benefits and decide what you want to do for the next year. IEP's initial enrollment period. Remember, that's when you're initially eligible for Medicare. In this example and scenario here, we're using when it's your 65th birthday because that's how most people age in to Medicare and become eligible. So it's the 3 months before your 65th birthday, it's the month of, and the 3 months after. So that's the 7-month period that you can enroll in in Medicare. For OEP, that is open enrollment period. It is not so open because it is only open to people who have a Medicare Advantage plan. If you have a standalone prescription drug plan, you're not able to switch out of that prescription drug plan during that time. It's from January 1st to March 31st. And then you have the SEP, which is our special enrollment period. If you moved out of the service area, if you're now going into a long-term care facility, if you now have a new chronic condition or you're Medicaid eligible or getting low-income cost sharing, you have a enrollment period that's specially designed that can open it up for you to enroll into one of those plans. Okay. In closing, what I also want to close out on is when you actually become effective. So now we know when you're eligible and can enroll, but once you pick that plan, when does your coverage go into place? So if you picked a plan during AEP and it's AEP, your plan is going to become effective January 1st of the following year. So if you pick a plan December the 1st of, say, 2022, then your plan will become effective January 1st, 2023. During your IEP, when it's you're turning 65, if you enroll the 3 months before your birthday, then you're going to become eligible on the first day of your 65th birthday. Okay? So AEP, you'll become effective January 1st. Your plan will go live. IEP is going to be the first day of your birthday month if you enroll the 3 months before. However, if you enroll the month of your birthday, you're not going to be effective until the first day of the following month. And that's how the rest of these sequences work. So the way CMS does it is if you enroll in the prior month, your coverage does not become effective until the first day of the following month. Okay, so that's important to know. In AEP, when you pick a plan, you become live on January the 1st. And then IEP, if you pick the 3 months before your 65th birthday, you'll go live on the first day of the month of your 65th birthday. However, if you wait until your birthday month or 3 months after, it's going to be the month after the month that you actually picked the plan and enrolled. And then OEP and SEP, same way. Whatever month that you actually enroll in, your coverage will not become effective or active or live until the first day of the following month. So I hope all of this was helpful. I am putting together a acronym so that breaks down all of these abbreviations, and you'll be able to download them along with this digital copy of this brochure to help explain this even further, or just as a quick reference guide. So in closing, we hope that you enjoyed the 4 enrollment periods of Medicare. If you have any questions, please drop them in the comment box below, and please stay tuned for future videos as we help to explain more things about Medicare to the general public. Thank you so much.